Have you ever felt like there's a hidden order to things, a secret rhythm? Well, what if I told you that that same idea applies to when and why we get sick? We're going to dive into a massive health study that's uncovered a pattern that's literally changing how we think about disease itself.
So, it all starts with this puzzle that, honestly, on the surface, makes zero sense. You've got three completely different conditions affecting teenagers: leukemia, which is a cancer, depression, a mental health condition, and diabetes, a metabolic disease. I mean, what on earth could possibly link those three?
The first clue is as simple as it is strange. It's not a gene, it's not what you eat, it's a season. All three of these, plus a few others, seem to be following this bizarre schedule, with cases spiking during the summer. All right, so let's take a closer look at this unexpected summer cluster, because this is really where the whole story kicks off.
Get this. For teenagers, right around the age of 10, the data shows this clear spike in diagnoses for all of these things in July and August. We're talking leukemia, congenital abnormalities, kids hitting puberty early, depression, and diabetes. And this is not just some fluke, it's a real statistically significant pattern that just begs for an explanation. How can such different problems all be marching to the exact same seasonal beat?
To figure that out, we have to look at where this discovery even came from. It's this incredible tool that's basically a health logbook for an entire country. We're talking about the database from the South Korean Health Insurance Review and Assessment Service, or HIRA. And it is one of the most amazing datasets of its kind anywhere in the world. So instead of just looking at a small group of people for one study, researchers get to analyze the anonymous health records of millions and millions of people, stretching back for years. It's like having this perfectly kept diary of a whole country's health. And this slide really shows you why this is such a huge leap forward. You know, the old way of doing things, meta-analyses, is great for confirming stuff we kind of already suspect, but it's limited. It can be biased. This big data approach, it's totally different. It's objective, it's massive in scope, and because of that, it lets you find these completely new patterns that nobody was even looking for.
So, with this incredibly powerful logbook, how did these data detectives actually go about decoding the secret rhythm of a disease?
Well, they started by mapping out what they call a seasonal fingerprint for each disease. And this is a perfect example. Just look at these graphs for gout. On the left, you see the pattern for people in their 20s. It's all over the place, kind of jagged, no real pattern. But now look to the right, for people in their 80s. See that? It's a clear, smooth wave that peaks every single year in the late summer. It's the same disease, but it has a totally different rhythm depending on how old you are. Okay, but that brings up a really important question, right? Millions of people get the flu every year, while way fewer get a rare cancer. If you just plotted the numbers, the flu chart would be this giant mountain, and the cancer chart would be a tiny little hill. So how in the world can you compare their patterns fairly?
The answer is this really clever bit of data science called pattern standardization. Here's how it works. For any disease, you just take its lowest point in the year and call that 0, and you take its highest point and call it 100. And just like that, the total number of patients doesn't matter anymore. All that you're left with is the shape of the wave, the rhythm. The giant mountain and the tiny hill are now the same size, and you can finally see if they actually rise and fall together.
And that leads us to the central hypothesis, the big aha moment of this whole thing. The idea is, if two totally different diseases, once you standardize them, show the same seasonal rhythm for the same age group, well, that's a huge clue they might share some hidden underlying cause. It could be something in the environment, a behavior, something tied to that season.
So, with this new method of comparing rhythms, the researchers could finally start connecting the dots and start drawing a map of these hidden connections between diseases.
And the map they created is called a disease dendrogram. The easiest way to think about it is like a family tree for illnesses. But instead of being related by genes, diseases are grouped together if they have a similar seasonal rhythm. So any illnesses that share a similar timing for a certain age group, they end up on the same branch of the tree, revealing the secret relationship nobody saw before.
And wouldn't you know it, right there on one of the branches for 10-year-olds was the answer to our original puzzle. The dendrogram clearly put leukemia, congenital abnormalities, precocious puberty, depression, and diabetes all together. Their rhythms were so similar, they were like siblings on this family tree, all pointing to some common hidden trigger that's active during the summer for teenagers. Just like that, the mystery was solved. Now this is way more than just solving one medical mystery. This map of hidden connections is opening up a whole new way of thinking about public health.
So what does this actually mean for you and me?
Well, for one thing, it could completely change health education in schools. Imagine teaching kids not just about one disease at a time, but about how their summer lifestyle might affect a whole cluster of health issues. For public health, officials could build early warning systems. Maybe they'd alert doctors to look out for signs of diabetes in teenagers in the summer, right when they know leukemia also tends to pop up. This is really the first step toward predictive medicine, a genuine weather forecast for our health, helping us all prepare for our personal seasons of risk.
And that really just leaves us with this one fascinating thought. For all of human history, we've kind of accepted sickness as this random thing that just happens. But what if it's not so random? What if it follows a predictable beat? What if, someday soon, we could check our health forecast just as easily as we check for rain? This research is the first real step to making that a reality.